pursuit of strengthened public health and improved well-being for all. Malaria control is one of the 4 global goals that the U.S. Health Foreign Assistance will contribute towards, alongside reductions in HIV, TB, and polio eradication under the America First Global Health Strategy. This is critical to safeguarding the U.S. and other countries around the world. Mosquitoes do not respect borders, and controlling malaria, particularly as mosquitoes develop resistance to traditional prevention techniques, is vital to ensuring that malaria doesn't reach or reappear in countries where it has been eliminated, including the United States. For example, we have seen increases in the number of malaria cases in the U.S. recently. Additionally, supporting malaria programs creates opportunities for American companies to deploy innovative tools and techniques in emerging markets, which strengthen U.S. global health leadership. Specifically, the United States is committed to supporting Uganda's vision of a malaria-free future and to contributing to 90% reduction in malaria incidence and mortality by 2030. The findings of the 2024-2025 Malaria Indicator Survey remind us that our work is far from over. While the report shows progress in some of the interventions like malaria preventative treatment during pregnancy and bednet use, it also shows that Uganda has stagnated or not taken to scale many of the interventions that the survey assessed. For instance, malaria prevalence increased from 10% in 2018-2019 to 13% in the 2024 to 2025 survey, and bednet ownership and access stagnated. Last week, the Honorable Minister of Health, Acheng, and Ambassador Pop participated in the Community Health Extension Worker, or CHOOS, graduation event in Mbara District. CHOOS provide the first line of care for children that develop early signs of malaria in many communities. However, only 35% of the households surveyed indicate that a CHO or village health team or VHT member was conducting malaria testing, and only 53% of households report that a CHO or VHT was distributing malaria medicines in their village. This is a clear example of where we need to use our valuable human resources more effectively for impact. The United States government is proud to continue its long-standing partnership with the government of Uganda in the fight against malaria. Between October 2024 and February 2026, we provided essential malaria commodities, including 2.6 million insecticide-treated mosquito nets, 4.5 million rapid detection tests, 2.2 million doses of treatment for uncomplicated malaria, and 200,000 treatment doses for severe malaria. We are funding an indoor residual spray campaign that commenced last month in 7 districts in eastern Uganda, targeting nearly 822,000 households and providing protection from malaria for about 2.9 million people. As I conclude, this report comes at a historic moment, following the signing of a 5-year, nearly $2.3 billion or 8 trillion Uganda shillings Memorandum of Understanding MOU on health cooperation between the United States and Uganda. This MOU reflects a shared commitment to life-saving services, resilient health systems, and the responsible use of American taxpayer dollars. It is an important part of the America First Global Health Strategy, which prioritizes self-reliance, national leadership, and durable systems that protect both Americans and Ugandans. The MIS report provides timely information to help us prioritize the most effective interventions for malaria prevention and control as we implement the MOU over the next 5 years. This MOU sets a new direction for our work together to contain the spread of infectious diseases, save lives, and enable economic growth. The United States will continue to work alongside the government of Uganda and all stakeholders so that every child, every family, and every community is protected from malaria. Each of us has a role to play. Together, we can reverse current trends, accelerate progress, and realize the vision of a malaria-free future. Thank you.